We are really proud that our inquiry filled the deafening silence from government when it was really obvious to all that rapid learning inquiry was needed. We are shocked at the avoidable loss of tens of thousands of lives through the neglect of pandemic planning, the rundown of the NHS, and the intense inequality in this country, and the wider impact that this has had on millions.
The fact is that the background is they knew, they practiced, they did nothing. A lot of people died unnecessarily in the second stage because they delayed for 2 months doing anything. And then when they did decide to do something, stage 3, what do? They plough money into private companies. And the pockets, as the National Audit Office pointed out, the pockets of friends and neighbours and relatives, huge sums of money which should have gone into the NHS.
We also know that the government made major mistakes in relation to its handling of the NHS. First of all, there was the view that if you throw money at a problem, that problem would inevitably be resolved. In other words, there appeared to be no comprehension that you need expertise and experience. And my examples here are, of course, the examples of PPE and of ventilators. You do not ask the manufacturer of vacuum cleaners to make ventilators. You do not ask people who are engaged in the fashion industry to make very, very skilled PPE. Yet that is what happened. And of course, in parallel with this, eye-watering sums, truly eye-watering sums of money were thrown at the private sector.
The social care started the pandemic with 120,000 staff vacancies, so everybody was on the verge of crisis already. And when the pandemic struck, these vulnerable people died in shocking, disproportionately high numbers. And those people included the poor, living in crowded conditions, mostly unable to work from home, unable to self-isolate if they got sick because they needed to put food on the table. We heard during this that the government were not engaged. They didn't follow WHO advice. They didn't take the pandemic seriously. They thought they knew best. And as a result of all of this, tens of thousands of people died avoidable deaths.
So I think sometimes on days like this, it's easy to forget the real human suffering and indignity that lies behind a report like this. Successive governments for over a decade now ignoring us frontline workers when we're warning them about the conditions in the NHS. And this government's repeated failure to listen, failure to learn, repeating the same deadly mistakes, which is why so many of us healthcare workers are angry and we feel really let down.
60% of people that died were disabled people, and the rate of death amongst the disabled community was just absolutely shocking. The rate of death amongst people with complex learning difficulty was even higher. This was not because they were ill, it was they weren't at increased risk because of the particular condition. They were placed at increased risk by the government's abandonment of them and the neglect of the risks that they faced.
And I think that the development internationally of vaccines, not just for this strain, there's going to be another one coming down the track. And until globally there's cooperation, whatever the government is, cooperation on an international level to ensure there's an equaling up, Boris, for everybody in terms of access to the vaccine, because unless you do that, we're whistling in the wind.
Really, I just want to say that this pandemic has genuinely exacerbated existing inequalities and really shone a light on those existing inequalities and widened them. And while this is a global issue, it's not too late to learn lessons. And this is a snapshot. This report is a snapshot of what has happened and how we responded. And it's shameful. But what we can take pride in my view, is that having asked the questions in most of the sessions, there was just the pride of people who selflessly put themselves on the front line day after day, helping others in need. And I just want to say thank you to everyone for coming today, and that the long report is available online at peoplescovidinquiry.com. Thank you very much.